Hello, welcome to Virginia Oncology Associates. My name is Dr. Michael Miller. I'm a radiation oncologist, and today I'm going to introduce you to one of our radiation oncology departments. When you are referred to Virginia Oncology Associates Radiation Oncology on your first day, the first step is to meet with one of our patient representatives. In the main lobby of our departments, there's a patient representative that will help you with your paperwork. Upon arrival, you may have completed some of the paperwork at home. If not, you can complete that here in the department. In addition to completing the paperwork that's necessary for the consultation, you'll want to have your insurance card with you for this portion of the visit. After completing the paperwork, we're going to move toward our nursing department. Now, as part of your visit, you're going to meet with a registered nurse. Our registered nurse is going to go over your medical history with you. She's also going to review some pertinent questions and information about your case, things that we'll be dealing with today. Another important part of this portion of the visit is to bring a full list of your medications with you, and better yet, maybe even bring your bottles with you so that we can record all your medications and have that information. It could be pretty relevant to your care in our department. In addition, if you have any medication allergies, we want to make sure you bring that information with you also. After working with our nurses, we'd head to an exam room. Most of our departments have multiple exam rooms, and this would be a pretty common example in this room. There'll be an exam table, there'll be some necessary equipment for examining the patient, and in these rooms you'll meet with your radiation oncologist. Typically on our first visit to our department, you'll spend anywhere from maybe 30 up to 60 minutes with the radiation oncologist. The information that you'll go over will be pertinent to your disease and your case, and those things will include the workup that you've had so far, such as imaging studies and biopsies, maybe surgery, maybe lab work. You'll also review treatment options for your disease, and that can include radiation therapy, and that's why you're here to discuss that possibility. The other thing that would be covered would be prognosis and other factors that would fit into the decision making that you'll have when you decide on treatment with your physician. This is an excellent time to ask questions about your case. They may be questions that you have, maybe even questions that your family members may have sort of given you to ask during your consultation. This is a good time to try to get those questions answered, and the radiation oncologist that you meet with will do everything they can to answer those questions within our ability. If we don't know, we'll do our best to look them up. Depending on what happens during your first visit, you may need to plan radiation therapy, and I'd like to take you to that part of the department where radiation planning takes place. So let's go this way. We're going to head to a room that we call the simulation room. Sounds pretty fancy. Let's go. Okay, come on in. When patients have radiation therapy, we need to design that radiation treatment specifically for each patient. That requires imaging so that we can look inside the body and see what's in there to design our treatment appropriately. This is the machine we use with you. This machine is called a CT simulator. You may have seen things that look similar because it looks an awful lot like a CAT scan. And it is a CAT scan machine, or a CT scan machine as people would call them. But this is the machine that allows us to look at the body in 3 dimensions, and sometimes in this type of planning we even use 4 dimensions. You say, well, good grief, how could there be 4 dimensions? When we can image a person, look at them on the inside, but also record movement within the body, maybe that's the lungs moving, maybe that's the heart beating, or any other part of the body that's moving. We record that with this machine, and allows our treatment to be very, very accurate. I'd like to show you a radiation machine too. Let's go this way. We're going to head to a machine called a linear accelerator. A little dark when we enter, but we're going to turn some lights on. This is a radiation machine. The technical term is called a linear accelerator. When patients are treated with radiation, they lie on this table. It goes very, very low, it goes very, very high. We can make it do anything we need to. It moves in all directions. It actually functions the same as the CAT scan or CT table that you just saw in the last room. The machine that actually delivers the radiation is right here. This is called a linear accelerator. It has some very, very fancy tools so that we can be very precise to treat your cancer in various shapes, sizes, and forms. The machine is a very technical machine, and the advances with this type of machine over the last 20 years are very, very impressive and allows us to give treatment to patients that are quite individualized. That's a radiation machine, and I want to take you back out to the front of the department and talk about what would happen at the end of your initial visit in our department. At the end of your visit, after meeting with the doctor, and whether any radiation planning or anything else was necessary, you'll check back out with our patient service representative. She'll schedule your next visit with the physician, potentially schedule other things like lab work, scans, or other appointments or referrals to the physicians that you may need to also see. At this point, your visit would be over, and we would look forward to seeing you on your next visit. Thank you.